Have you ever felt your heart racing, your thoughts spinning out of control, and an overwhelming sense that you just can't keep up with everything around you? You might have been told it's anxiety, or maybe you've even diagnosed yourself with anxiety. But what if I told you that what you're experiencing might actually be ADHD? I'm Dr. Emily Thompson, and after 12 years of specializing in neurodevelopmental disorders, I've seen hundreds of patients who spent years treating anxiety without results, only to discover they actually had undiagnosed ADHD all along. Today, I'm going to walk you through exactly how ADHD can masquerade as anxiety, why this misdiagnosis is so common, and most importantly, how to tell the difference so you can finally get the right support and treatment. If you've been struggling with what you thought was anxiety, but treatment hasn't quite worked the way you hoped, this video might contain the missing piece of your mental health puzzle. Have you ever felt like your anxiety doesn't quite match what others describe? Let me know in the comments below if you've ever suspected there might be something more going on than just anxiety. This video is specifically for those of you who have been diagnosed with anxiety or who have been treating yourself for anxiety, but still feel like something isn't quite clicking. Maybe you've tried multiple anxiety medications that either don't help or make you feel worse. Perhaps you've spent countless hours in therapy learning coping strategies that work for everyone else, but somehow don't quite address what you're experiencing. You might find yourself constantly fidgeting, interrupting others in conversation, losing track of important items, or struggling to stay focused during meetings or conversations, and then feeling anxious about these behaviors afterward. I understand how frustrating and demoralizing it can be to feel like you're doing everything right to manage your mental health, but still struggling. You might feel broken or defective, wondering why anxiety management techniques that work for others don't seem to work for you. The confusion between ADHD and anxiety is incredibly common, and it's not your fault if you or even your healthcare providers have misinterpreted your symptoms. Both conditions can create a sense of overwhelm and mental chaos that makes daily life challenging. Both can affect your sleep, your relationships, your work performance, and your self-esteem. But understanding the subtle yet critical differences between them can completely transform your approach to treatment and self-care. You're not alone in this confusion. Research suggests that up to 80% of adults with ADHD have at least one other co-occurring mental health condition, with anxiety disorders being among the most common. Many people spend years treating the anxiety symptoms without addressing the underlying ADHD, which can leave you feeling like you're constantly taking one step forward and two steps back. If what I'm saying is resonating with you so far, and you're finding this information helpful, please take a moment to hit that like button and subscribe to the channel. Your support helps this important information reach more people who might be struggling with the same confusion you've experienced. Let's dive into the 5 key differences between ADHD and anxiety that can help you determine what's really going on in your brain and why understanding these differences is crucial for effective treatment. First, let's examine the nature and content of racing thoughts. With anxiety, your racing thoughts typically center around worry, fear, and anticipating negative outcomes. You might find yourself thinking, what if I fail this presentation? What if people think I'm incompetent? What if this physical sensation means something is seriously wrong with my health? These thoughts often follow predictable worry patterns and focus on specific threats or fears. With ADHD, racing thoughts are fundamentally different. Rather than circling around specific worries, ADHD thoughts tend to be random, disconnected, and often not negative at all. People with ADHD describe their mind as a browser with 100 tabs open, constantly generating new ideas, making random connections, or getting distracted by internal and external stimuli. You might find yourself in a meeting and suddenly remember you need to buy dog food, then wonder if dogs in different countries eat different food. Then remember a documentary you wanted to watch about wolves, all while trying to focus on what your colleague is saying about quarterly reports. Why is this distinction so important? Because the treatments target completely different mechanisms in the brain. Anxiety treatments like cognitive behavioral therapy focus on identifying and challenging irrational fears and teaching you to recognize cognitive distortions. But if your racing thoughts aren't actually based in fear or worry, these approaches won't address the root cause. ADHD, on the other hand, is fundamentally an issue with executive function and dopamine regulation. ADHD treatments focus on improving neural pathways that help with focus, working memory, and cognitive control, either through medication that targets dopamine and norepinephrine systems, or through behavioral strategies that provide external structure and support for executive functions. You can apply this understanding in your daily life by becoming more aware of the content of your racing thoughts. Next time your mind feels chaotic, take a moment to notice. Are you worried about something specific happening? Or is your mind just jumping from topic to topic without any particular emotional theme? If it's the latter, traditional anxiety reduction techniques like challenging negative thoughts might not be as effective as ADHD management strategies like externalizing information, writing things down, using timers to focus your attention, or breaking tasks into smaller steps with clear starting points. Second, let's talk about the relationship with boredom and stimulation. This is perhaps one of the most telling differences between anxiety and ADHD. People with anxiety typically find that their symptoms get worse with increased stimulation. Busy environments, multitasking, or high-pressure situations often trigger or worsen anxiety. The anxious brain is already hyper-aroused and perceives additional stimulation as threatening. In stark contrast, people with ADHD often find that their symptoms improve with the right kind of stimulation and worsen with boredom. This is why many adults with ADHD report feeling calmer and more focused when they're engaged in stimulating, interesting activities, or even when they have some background noise. Many people with ADHD actually seek out stimulation through multitasking, listening to music while working, or fidgeting because it helps their brain maintain an optimal level of arousal. This seemingly paradoxical reaction to stimulation is due to the ADHD brain's difficulty regulating dopamine, a neurotransmitter crucial for motivation, attention, and sense of reward. This distinction has profound implications for treatment. Anxiety management often involves reducing stimulation through calming techniques like deep breathing, meditation, and simplifying your environment. But following this advice when you actually have ADHD can sometimes make your symptoms worse by removing the stimulation your brain needs to engage. Someone with ADHD might need to add appropriate stimulation through background music, movement opportunities, or breaking monotonous tasks into more engaging chunks. In your daily life, notice how different levels of stimulation affect your focus and emotional state. If you find that you actually focus better with some background noise, or if you feel more at ease when you can move around or fidget, these might be signs that what you're experiencing is related to ADHD rather than pure anxiety. Try experimenting with adding strategic stimulation rather than removing it. Use instrumental music while working. Try a standing desk or balanced ball chair, or schedule short movement breaks throughout your day. Third, let's examine the relationship with deadlines and pressure. This difference can be particularly revealing when distinguishing between anxiety and ADHD. People with anxiety typically experience increased symptoms as deadlines approach. The pressure creates more worry, fear of failure, and physical symptoms of anxiety. As a result, many anxious people cope by starting tasks early, over-preparing, and avoiding last-minute situations that trigger their anxiety. In contrast, many people with ADHD exhibit what's called deadline-driven productivity or last-minute motivation. They may struggle to start tasks without the pressure of an imminent deadline, regardless of how important they know the task is. Then, as the deadline approaches and the consequences of not completing the task become immediate rather than theoretical, the ADHD brain finally produces the neurochemicals needed for focus and action. This often results in a pattern of procrastination, followed by intense hyperfocus and productivity at the last minute. Understanding this difference is crucial because the pattern of procrastination followed by last-minute action can look like avoidance due to anxiety, but it has a completely different neurological basis. Anxiety treatments would focus on managing the fear response to deadlines, while ADHD management involves creating structures that either provide artificial deadlines or break tasks into smaller components with more frequent deadlines and rewards. In practical terms, if you notice that you consistently struggle to start tasks until they become urgent, regardless of how much you want to do them earlier, this might be a sign of ADHD rather than anxiety. Instead of trying to reduce your stress around deadlines, you might experiment with creating artificial urgency through techniques like body doubling, working alongside someone else, the Pomodoro technique, working in short, focused intervals, or using apps that create accountability and immediate consequences. Fourth, let's talk about restlessness and the inability to relax. Both anxiety and ADHD can make it difficult to sit still or truly relax, but for different reasons. With anxiety, restlessness comes from a state of hypervigilance. Your body is in a persistent fight or flight mode, scanning for threats and ready to respond to danger. This type of restlessness is accompanied by worry, muscle tension, and a sense that you need to be on guard. With ADHD, restlessness stems more from understimulation and the brain's constant search for dopamine. This type of restlessness feels more like boredom, impatience, or a need for novelty and engagement rather than a response to perceived danger. People with ADHD often describe feeling restless or bored, even when doing activities that should be relaxing, like watching TV or lying on the beach. They may find themselves fidgeting, shifting positions frequently, or getting up multiple times during activities where others can sit still. This distinction matters because the treatments address different underlying mechanisms. Anxiety-related restlessness responds to relaxation techniques, mindfulness practices that help you feel safe, and addressing the underlying worries. ADHD-related restlessness, however, often responds better to physical activity, engaging multiple senses, or providing just enough stimulation to satisfy the brain's need for dopamine without becoming distracting. In your daily life, pay attention to what happens when you try to relax. Do you feel tense and worried or just bored and antsy? If traditional relaxation activities leave you feeling more agitated rather than calm, try more active forms of relaxation like walking in nature, gentle yoga, or creative activities that engage your mind and body simultaneously. For many people with ADHD, relaxation might look different than the traditional image of sitting still in meditation or taking a quiet bath. Fifth, let's explore how medication responses can differ between anxiety and ADHD. This can be one of the most telling indicators of what's really going on. When someone with primary anxiety takes anti-anxiety medications like benzodiazepines, such as Xanax or Klonopin, they typically experience a reduction in their symptoms. The racing thoughts slow down, the physical tension decreases, and they generally feel calmer. In contrast, when someone whose symptoms are primarily caused by ADHD takes these same anti-anxiety medications, the results are often less helpful. They might feel sedated but still mentally restless, or they might find that their racing thoughts continue even though their body feels more relaxed. Even more tellingly, some people with undiagnosed ADHD report feeling unusually calm and focused when they try stimulant medications, the opposite of what you would expect if anxiety were the primary issue, since stimulants typically worsen anxiety symptoms. This distinction is crucial for treatment planning. Treating ADHD with anti-anxiety medications alone might provide some relief from the secondary anxiety that develops from living with untreated ADHD, but it won't address the core executive function challenges. Similarly, treating anxiety with ADHD medications could potentially worsen anxiety symptoms if ADHD isn't actually present. Of course, I'm not suggesting you experiment with medications on your own. Always work with qualified healthcare providers for diagnosis and medication management. But if you've tried anxiety medications without the expected relief, or if you've noticed that caffeine, a mild stimulant, sometimes helps you feel paradoxically calmer and more focused rather than more anxious, these might be clues worth discussing with your healthcare provider. Let's look at one more critical difference: the relationship between symptoms and interest level. People with anxiety typically experience anxiety regardless of how interesting or engaging they find an activity. In fact, they might feel more anxious about activities they care deeply about because the stakes feel higher. In contrast, people with ADHD often exhibit what's called interest-based nervous system. Their ability to focus, organize, and execute tasks fluctuates dramatically based on how interesting, novel, challenging, or urgent they find the task. This isn't a matter of willpower or laziness. It's a fundamental difference in how the ADHD brain regulates attention and motivation. People with ADHD might hyper-focus for hours on activities that engage them while struggling to maintain even basic attention on tasks they find boring, regardless of how important they know those tasks are. This distinction has important implications for managing daily life. Anxiety management tends to focus on reducing worry and physiological arousal regardless of the activity. ADHD management, however, often involves finding ways to make necessary but uninteresting tasks more engaging, breaking them into smaller pieces, pairing them with more stimulating activities, or creating external structures that don't rely on interest level for completion. In practical terms, if you notice that your ability to focus and your level of mental discomfort vary dramatically based on how interesting you find a task, regardless of its importance, this might suggest ADHD rather than pure anxiety. Try strategies like the ADHD tax, building in rewards for completing boring tasks, body doubling, working alongside someone else, or finding ways to gamify routine responsibilities. Let me share a story about my patient Jennifer, name changed for privacy. She came to me after 15 years of treatment for generalized anxiety disorder. She tried every anxiety medication, countless therapists, meditation retreats, and even relocated to a less stressful city. Nothing provided lasting relief from what she described as constant mental chaos and overwhelm. During our sessions, I noticed patterns that didn't quite match typical anxiety. Jennifer wasn't actually worried about specific outcomes. She was frustrated by her inability to stay organized, follow through on plans, and focus on conversations. When we explored her history, we found classic ADHD symptoms dating back to childhood that had been overlooked because she was academically successful and not hyperactive in the stereotypical way. After proper diagnosis and treatment for ADHD, Jennifer experienced what she called life-changing relief. She told me, for the first time, I can actually finish a thought without 20 others interrupting it. I'm not anxious about failing anymore because I can actually follow through on what I start. I spent years blaming myself for not trying hard enough when my brain was just wired differently all along. Thousands of adults like Jennifer have discovered that what they thought was treatment-resistant anxiety was actually undiagnosed ADHD. Once they received appropriate treatment targeting the executive function challenges at the root of their symptoms, many found that their secondary anxiety symptoms improved significantly as well. I frequently receive comments from viewers like, "After watching your video, I talked to my doctor about the possibility of ADHD instead of just anxiety. After proper assessment and starting treatment, I feel like I'm finally addressing the real problem instead of just putting band-aids on the symptoms. For the first time in my adult life, my brain feels quiet enough that I can actually think clearly." One small but powerful step you can take today is to start tracking the context of your symptoms. Create a simple note in your phone with 3 columns: what you were doing when you felt overwhelmed or anxious, how interesting or engaging you found that activity on a scale of 1 to 10, and what specifically was going through your mind. After a week of collecting this data, look for patterns. Do your symptoms primarily occur during boring, routine tasks regardless of their importance? Do your racing thoughts contain specific worries, or are they random and disconnected? Does a looming deadline, suddenly make it easier to focus despite the pressure. These patterns can provide valuable insights into whether what you're experiencing aligns more closely with anxiety or ADHD. This isn't about self-diagnosis. Proper assessment by qualified professionals is essential. But becoming a better observer of your own patterns can help you have more productive conversations with healthcare providers and advocate more effectively for the right kind of support. Many adults, especially women and high achievers, have had their ADHD overlooked because they don't fit the stereotypical presentation or because their anxiety symptoms are more visible to others. If you're finding this information helpful and it's shedding light on your own experiences, please take a second to hit that like button and subscribe to the channel. Your engagement helps this critical information reach more people who might be struggling with the same confusion between ADHD and anxiety. I want to emphasize that ADHD and anxiety are not mutually exclusive. In fact, they frequently co-occur, and untreated ADHD often leads to secondary anxiety as you try to cope with the challenges it creates. The goal isn't to replace one diagnosis with another, but to ensure you're addressing all aspects of what you're experiencing with the most effective strategies for each. Remember that getting a proper assessment from healthcare providers experienced with adult ADHD is crucial. Unfortunately, many clinicians received training when ADHD was still considered primarily a childhood disorder affecting boys, so you may need to advocate for yourself and seek out specialists who stay current with the evolving understanding of how ADHD presents across the lifespan, especially in women and in people with higher intelligence who have developed sophisticated coping strategies. If this video has helped you understand these conditions better, please consider sharing it with someone who might be struggling with similar challenges. So many people suffer silently, believing they just need to try harder or worry less, when what they really need is appropriate treatment for a neurodevelopmental condition that affects every aspect of their daily functioning. I'd also love to hear in the comments if any of these distinctions resonated with your personal experience. Have you been diagnosed with anxiety but recognize some of these ADHD patterns? Or perhaps you've already discovered that you have both conditions and have insights to share about how you manage them. Your stories not only help others feel less alone, but also contribute to our collective understanding of how these conditions affect real people in real life. Thank you for watching this video. Understanding the differences between ADHD and anxiety is the first step toward getting the right support and finally experiencing relief from symptoms that may have been misunderstood for years. Whether you have anxiety, ADHD, or both, you deserve treatment that addresses the real root of your challenges. I'm Dr. Emily Thompson, and I'll see you in the next video with more insights on navigating neurodiversity and mental health.